Okay. Well, good afternoon and Happy New Year to everyone that's joined us today. I'd like to call the first meeting of the Laguna Honda Hospital JCC together for 2024. And turn it over to Secretary Morwitz.
Yes, I'll start with a roll call. Commissioner Chow,
Present.
Commissioner Green,
Present.
and Commissioner Guillermo.
Present.
And I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. The second item on the agenda is the approval of the November 14th, 2023 minutes.
Okay, you have the minutes before you. See if there's a motion to approve.
So moved.
Second.
Second. Okay, is there public comment?
There is public comment, and I have something to share in order to do that. Give me 1 second to share. Or actually, I can't do two things at once. Mr. Manetchal, hold on for 1 minute while I open up the share.
Okay, thank you. Can you hear me all right?
Yes, sir, we can. Just give me, that's a little complicated on my end to share from this computer, so just give me a second.
I apologize for my voice, but there's nothing I can do about it.
Okay, Mr. Manetchal, I'm going to put, I got 3 minutes on the clock. I have your visual up on the screen, so please begin.
All right, thank you, Mr. Morwitz. The minutes include my testimony about the regulatory affairs report through last October. But as you can see on this chart, the data has changed to the end of the year through December. There were 69 fewer abuse FRIs for the full year, perhaps because of no admissions. But offsetting those 69 incidents, there was a massive increase of 41 more serious, my terminology, FRIs, doubling from 42 to 83, including 8 staff and resident neglect, which seems to be a new category of FRIs, 8 more injuries of unknown source, 7 more disease outbreaks, and 11 more adverse events, tripling to 16 adverse incidents, plus 3 potential privacy breaches, which may be underreported since another 3 medical record breaches in December may not have been self-reported. The 10 disease outbreaks in 2023 are particularly concerning, suggesting Laguna Honda staff may still not be following adequate infection prevention and control practices. Was Laguna Honda's infection preventionist unable to get infection control under control? Thank you.
Thank you. That, I believe, is the only public comment on this item. Let me verify. Yes.
Okay, then if we could have, we have the motion.
A vote, yes. So Commissioner Chow, I have to do a roll call vote because we have a remote participant. Commissioner Chow, how do you vote on this issue?
Yes.
Commissioner Green, how do you vote on this issue?
Yes.
And Commissioner Guillermo.
Yes.
All right, the minutes are approved. Thank you. We can move on to general public comment. Item 3. Folks, this is the time to make comment on issues that are not listed on the agenda. I see none in the room. I see one hand. Mr. Minetshaw, do you have a comment for this item?
I do.
Yes,
Yes.
you've got 3 minutes.
Thank you. As for items not on today's meeting agenda, why is there no LHH vacancy report by full-time equivalent status on today's agenda? Have vacancies of direct patient care staff worsened? Why wasn't this included as a published agenda item for discussion and or action on today's agenda? Thank you.
Thank you. I hope it's okay for me to mention that the agenda has been truncated a bit so that staff could work on the plans of correction in response to the surveys. We can move on to item 4, the executive team report.
Okay. Mr. Pickens?
Good afternoon. Good afternoon, Commissioners. Roland Pickens, Director and CEO of the San Francisco Health Network and executive sponsor of the Laguna Honda Recertification Incident Command. As you know, typically I'm joined in these meetings by our nursing home administrator and CEO, Sandra Simon. As referenced by Secretary Marwitz, Ms. Simon is currently working with the leadership staff on the plan of correction from our most recent survey. So she's not here physically with me, but she and a few other key members of the staff are joining us remotely to be able to help address any questions that may come up. And as we get into parts of the report dealing with quality management, regulatory affairs, and performance improvement, that leadership will come out of their plan of correction meeting to join this meeting to hopefully address any questions that come up. So it's my pleasure to present you this update on recertification efforts at Laguna Honda. As you'll recall, after a successful recertification survey in August of last year, Laguna Honda was approved for recertification in the Medicaid program by the California Department of Public Health. As you know, more than 95% of the residents at Laguna Honda rely on Medicaid funding for their care. So that was a very significant achievement for us. You also know that most recently in December of 2023, we had our Medicare recertification survey. Last week, we received what's called a CMS 2567 Statement of Deficiencies for that December CMS Medicare recertification. We received the 2567 for the health monitoring portion of that survey on January 2nd. And we received the 2567 for the fire, life safety, and emergency preparedness portion of the survey on January 3rd. While we expect findings for a facility of our size, our goal is always to ensure that those findings are few, are minor, and are not widespread. I'm pleased to report that this new set of 2567s shows the continued improvement from prior CMS monitoring surveys, giving both a lower scope and severity of findings and fewer findings. For example, the CMS survey from December of 2022, we had 42 clinical deficiencies. In the CMS survey from June 23, that number dropped from 42 to 34. And in the most recent December survey, that number dropped from 34 to 15. So again, we are seeing continued improvement as validated by these regulatory surveys. We want to thank our Laguna Honda staff for their dedication to this improvement and the excellent resident-centered care they provide. The next step in our process is to develop the aforementioned plan of correction for these new 2567s. As I mentioned, even as we meet now, staff is hard at work developing this robust response, detailing our corrective actions and our plans to sustain the improvement over the long term. These improvements and corrective actions actually began during the survey as staff responded in real time to surveyors. The plan of correction for fire, life safety, and emergency preparedness is due back to CDPH on January 13th, and the plan of correction for health monitoring is due on January 17th. CMS, upon receipt of our plans of correction, will then have to go through a process to first approve the plan of correction and then a validation of that plan of correction. I think it's important to note that this validation will not involve a subsequent survey. There is no additional period of reasonable assurance as we had with the first and second Medicare surveys. Once CMS approves our plan of correction and then validates our plan of correction, we anticipate then we will be able to be recertified in the Medicare program. As you know, Laguna's made significant improvements throughout the recertification process, and a great deal of positive change in operations and leadership has occurred. It's critical that these improvements are sustained even as we approach recertification in the Medicare program, and that we never find ourselves in this position again, and that we ensure the excellent and regulatory compliant care that we've pursued over the last several months and years is sustained for the long term. To help achieve this, we will resume admissions when we are confident that the changes and the improvements that we've made are sustained for the long term, because this will ensure the critical success of Laguna in the future. Even as we approach recertification, sustainment of these improvements is the key to long-term stability. We recognize the key role that Laguna Honda plays in San Francisco and the Bay Area in terms of the number of skilled nursing beds. And we are working hard to resume our regular operations as soon as possible, including pursuing a waiver at the appropriate time for the reinstatement of those 120 beds that were lost due to new CMS regulations that occurred during our prior to our recertification process. We look forward to returning to the JCC and the full Health Commission after we are really recertified to share with you our plans for sustained improvement and return to regular operations, which includes then the readmission process. And finally, in terms of regular operations, I'd like to update you on some new leadership changes at Laguna. Last Friday was the last day for one of our directors of nursing, Michael Collins, who was the director of nursing for the South Tower. He ended his employment with the city last Friday. And on an interim basis, the coverage plan is that Tracy Brown, the nursing director for the North Tower, will also assume responsibility for the South Tower, and she will be supported by Terry D'Antoni, the incident command nurse executive, who will oversee nursing operations and the acute care functions at Laguna as we search for a replacement for Michael. So that concludes my update on the recertification process, and I'm happy to take questions or comments at the appropriate time.
Thank you, Mr. Pickens. Is there public comment?
Hi, yes, there is, Commissioner. I see one hand. Folks, we're on item 4. If you'd like to make comment, please press *3 for those of you participating remotely. I see one hand, and I will Unmute. Mr. Manette Shaw, are you there?
I am.
Okay, you've got 3 minutes.
Thank you, Mark. CMS's published process to obtain Medicare's recertification as a participating provider requires all SNFs nationwide undergo 2 full recertification inspections separated by that mandatory 90-day reasonable assurance waiting period between the 2 inspections. We've heard Laguna Honda's Medi-Cal inspection that should have happened after Laguna Honda applied for Medi-Cal recertification on August 11th, but was technically a mandatory 90-day monitoring survey required by the LHH settlement agreement that occurred last June before submitting its Medi-Cal application will be counted to have been the first of the 2 Medicare surveys. Since when do contractually required 90-day monitoring surveys under a decertification settlement agreement count toward full recertification inspections? As CMS approved this creative interpretation of its usual and customary standard rules applicable to all SNFs nationwide, I find it strange that the next agenda item on regulatory affairs report say that there were a total of 6 plan of corrections submitted in December and November, and yet you're now saying, Mr. Pickens is now saying that the plan of corrections won't be turned in for another week. And it's strange that in addition to the 15 citations, that there were 5 violations of F-tags and at least 3 potential violations of California Health and Safety Code 1280 that involve potential breaches of
Your time is
patient.
up, Mr. Manette Shaw. Thank you.
All right.
All right, we have one more caller. Caller, are you there?
Hi, it's Dr. Palmer. I asked for remote accommodation, so I don't know whether I got it or not. But anyway, I wanted to ask, can you hear me?
Yes.
Okay, I just wanted to ask, when was the 2567 received? And what is the difference between approval and validation? What does that exactly mean? What is the time period involved, and what actions are involved in validation versus approval? And the other thing is, last we heard in October, November, there were a lot of people waiting for discharge to the community that hadn't been discharged because of lack of safe or local options. I think there were 75. How many of those people have been discharged? And how many people remain at Laguna Honda? And how many of those that remain at Laguna Honda are waiting for safe discharge? Also, what are you doing to make sure that people who are evicted can return? Do you have a list of people who are still alive that were evicted to other nursing homes that should be returned to Laguna Honda? What are you doing proactively to make sure that anyone who wants to return, who was evicted, who remains alive and SNF eligible can be readmitted. I would appreciate hearing about this. Thank you very much.
Thank you. That's the end of the public comment.
Okay, thank you. Are there comments or questions from members of the committee? Anyone?
Uh,
Oh,
I,
Commissioner Chow.
yes, thank you. I just wanted some clarification from Mr. Pickens in regards to the sustaining improvement prior. I thought I heard that we were going to sustain prior to, and therefore we need a definition of sustaining prior to admitting. So could you clarify that? Let's say that you got permission March 1 to be recertified, or February 1. What's a period of sustainability that you're looking at?
Thank you for that. Thank you for that question, Dr. Chow. As I said previously, we will plan to come to the commission and actually present to you, I think, a definition of what that sustainability would encompass and how it would be measured in order for us to then make the decision that we're ready for readmissions. So the group being led by the medical director, Nita Ratana-Wangsa, Dr. Lamb, and Sandra Simon, they are actually putting together that proposed sustainability plan that we will, as I mentioned in my report, bring to this group to outline our proposal of then what are the sustained activities that need to be measurable and documented in order to feel comfortable with resuming admissions, knowing that, number one, we have the staff and more importantly, the sustained regulatory compliance at the bedside to make sure that we can safely resume admissions.
Okay, so we're expecting to see that either at the joint conference here and the commission in terms of what your plan is, so that just simply because we've received a recertification, of course, that kind of depends somewhat on when that happens. You're, however, sort of anticipating kind of a period yet prior to admissions.
That is correct. The plan is to bring that both first to the Laguna JCC and then to the full Health Commission.
Okay, and let's clarify once again, because it sounds like some people are a little confused, that we believe, or you believe rather, because I don't really know, that that this is in compliance with the that the CMS survey is in compliance and could, after the review of our corrective action plans, bring about a recertification.
Yes, that is correct. That the Medicare survey in December actually represented that second qualifying survey after the 90-day reasonable assurance period from the Medicaid survey that served as the first survey for Medicare. So there are no additional 90-day periods of reasonable assurance upon approval and validation of our plan of correction. Then CMS has the option to recertify us in the Medicare program.
Okay, I think that's a helpful clarification. And since the public did bring up, did we have any more discharges from the group of patients who were felt not to be eligible at this point, or?
Yes, yes, I actually have the numbers right here. So you'll recall we were directed by actually Health and Human Services in April of 2022 to resume discharges of residents who no longer had skilled nursing levels of care. Since April of 23, a total of 19 Laguna residents who no longer had skilled nursing needs have been discharged. And there are currently 48 additional residents who are currently at Laguna who no longer have skilled needs, for whom discharge planning is actively being worked on, and they're in various stages in terms of identifying placements for them to go.
Okay, thank you. That ends my questions.
Yeah, well, thank you for the report. I wonder if you can give us a sense of timeline in terms of when we'll hear back from CMS, maybe based on the other surveys and when we've heard back, um, and what we might expect when we do. And also, I think the other correlate to that would be if you can let us know. We've had a lot of outside support. We've had HSAG and these other organizations. We've had the clinical care at the bedside program that's obviously been incredibly successful. But I'm wondering if you have a sense now of how we're going to, in our sustainability plan, whether we'll continue with our own staff doing the bedside monitoring. Do you have any of the elements that you envision as critical to sustainability of how we're going to swap out those consultants that have been part of this, and then the additional staff that's been a part of this, but still be able to sustain? Have you got, I understand the timeline and what constitutes the process for sustainability is still in evolution, but what about the manpower to continue to monitor and so forth?
Sure. So I'll try to start with the first question about timelines for CMS. I mentioned that the plans of correction are due on January 13th and then the 17th. Typically, once we submit that plan of correction, there's back and forth. CMS and CDPH will read through it and then come back to us with several clarifying questions or saying, well, we don't understand this, please explain it, or we don't like this proposed plan of correction, give us something else. That can take anywhere from 2 weeks to 6 to 8 weeks. And it just depends. Because there were so few findings, we're anticipating that they won't take that long, perhaps only a couple of weeks. So then they would, once we have made whatever clarifications or corrections that they've required, they would then approve the plan of correction. Once the plan of correction is approved, all of the elements in that plan of correction must be fully completed and the facility to be found in compliance within 30 days. So upon approval, if approval takes 2-3 weeks, then add 30 days onto that. And then they would come and do a validation to say, okay, we approved your plan 30 days ago. It's been 30 days. We're now here to see, did you correct those things? So they will probably come on site, not to do a full survey, but just to review documents in terms of what we submitted for the plan of correction. If we said there will be 15 pass audits, they will say, show us how you documented these and they were done correctly. Once upon validation, then CDPH will make a recommendation to CMS saying, we, CDPH, have validated that Laguna Honda has successfully completed this plan of correction. And then CMS has the sole responsibility and authority to say, you have completed and we are now recertifying you and approving you for participation in the Medicare program.
Haven't we had some delays in that 30-day window in the past?
Yes, we have.
What was the most outlier interval that we've had?
It's about almost 3 months, more or less.
Okay.
But I will say, in our recent conversations with both CDPH and CMS, everyone is really on board with trying to move this forward as quickly as possible. So I'm much more optimistic this time around than we've been in the past.
And then the question about
Oh.
the staffing and
Yes,
all the
yes.
help we've had and how we're going to.
Right. So we've been working on this sustainability transition plan for a few months. Of course, we couldn't fully work on it until we went through our last survey to see what additional findings we may have. But the plans are over the next, at least the next 6 months through the end of this fiscal year, to be in a more self-sustaining state where we are not relying upon contractors or consultants. Having said that, I can tell you when we do come to present our plans, there will be a component of external checkups by external experts in skilled nursing quality, again, to make sure that we don't get in this position again, that not only are we monitoring ourselves internally, we're going to have some external quality improvement validation in the plan that we present to you, hopefully either in February or at the latest March.
Thank you. We will really look forward to that. And I'm delighted to hear that you're going to have kind of external third-party review, because if anything, that'll validate the work and make everyone feel more confident going forward. So that's really wonderful. Thank you.
Thank you for your the answers to these questions. Just one, I think, final one is with regard to the readmissions. Who is the group, or what is the team that has been working on the plan, and how long have they been sort of together working on that plan?
Sure. So that team is Nita Ratana Wangsa, who had been the interim chief medical officer. She started that process with Sandra Simon back in late November, December. Now that Dr. Lamb has come on board, and he is downloading from Nita, and he will then join Sandra in chairing that group, looking at the current admissions policy, and then all of the essential things. Do we have enough staff at each level? For example, do we have enough dietary workers, enough activity therapists in order to bring on X number of new residents as we begin the readmission process? So they're collating all that data, and that'll be part of the presentation that they bring to say, based upon what we know in terms of the most recent survey and our plans of correction, and from a staffing perspective and from a program redesign perspective, we believe we can start admissions on X date and at X pace, whatever that is. My understanding is the group is talking about having a tiered process rather than opening the floodgates all at once, doing a certain number of admissions per week or per month, so as to not overwhelm the system and be able to make sure that we can safely take care of new residents as they come in. And also, as I've mentioned here previously before, we continue to remain committed to giving first priority to those residents who were transferred to other skilled nursing facilities, who, if they desire to come back to Laguna and still have skilled needs, they will have first priority for readmission.
Okay, great. That's good to know. And so hopefully we'll also have learned, or will be learning, about the waiver for the 120 beds, so that will be considered in terms of the overall plan as appropriate.
Yes.
Correct. Then one other question. I know Dr. Chow has a follow-up as well, but I know that we're going to be having some concerns around, or some decisions to be made around budget issues that are going to be hitting the whole city, not just this department, and then within the department, not just certain parts of it and all of it. So, and I know you don't have all that information yet, but I think it would be important for us to really sort of understand how the potential budget issues may affect your plans for sustainability, for readmission, for, all of the things that are going to be needed to be in place to assure the success, the long-term success of all of
Thank you
these plans.
for bringing that up. And I believe you're due for a budget presentation, I think at the next Health Commission or either later today. And so as being part of the network, Laguna, like every other part of the Department of Public Health, in conformance with the directions from the mayor's office in terms of budget, Laguna does have a budget reduction target. I believe it's around $6 or $7 million. Compared to the overall health network of about 38 million, roughly. So the staff, Sandra and staff, are working and have worked, are putting together scenarios as to how Laguna can meet that target. The details are not yet known, and I will be coming forward both to the JCC and the Health Commission as the department's budget process rolls out. And so that is another factor. At the same time, while we're gearing up to open up for readmissions, we're also having to do some belt tightening in terms of reducing our overall budget.
Thank you. And hopefully with the readmissions that we'll be seeing an increase in revenue that we haven't been able to see in the last 2 years, almost 2 years. So
Good
I
point.
know that's going to be a consideration. So we'll go to Commissioner Chow now.
Yes, thank you. You know, in our haste of being excited about the future, I think we forgot, and I'm sure that the chair will express the uh, gratitude of the joint conference for the work that the staff has really been doing. And I think the last commendation to the entire staff was so warranted in view of this survey. It's remarkable considering that it's such a big institution that in less than about 2 years, you really turned the ship around to meet the new requirements that the government has imposed over the last few years upon what a SNF should be looking like. So I just wanted to give my personal expression of thanks to you and the entire staff for this remarkable turnaround.
Thank you very much, Dr. Chow. As I always tell people, CMS recertification is a team sport. So we accept your group thanks.
Thank you.
Okay, thank you. I think there are no more comments or questions and we can move on. Thank you.
Thank you, Mr. Pickens. Item 5 is the Regulatory Affairs Report, and we're looking at both November and December of 2023. Geraldine, can you
Yes,
get on
good
camera,
afternoon,
please?
Commissioners. My name is Geraldine Mariano, Director of Regulatory Affairs, and I'll be sharing the Regulatory Affairs Report for Laguna Honda. I will present 2 months of Regulatory Affairs Report for November and December 2023.
Is it
For the-
possible to turn on your camera,
Oh,
Geraldine?
oh, sorry. I thought I
It's okay.
did.
Oh, that's great. I see you now. Thank
Oh,
you.
okay. I'm so sorry.
No worries.
So for the facility reported incidents, there were 16 incidents reported in November, and there were 13 reported in December. Laguna Honda also received 6 anonymous complaints in November 2023 and 0 in December 2023. So just like Mr. Pickens reported earlier, we completed our survey for our first certification survey. There were at least 27 surveyors on site for the health safety code. Survey was completed from November 27 to December 1, and they have exited on December 1. We received our findings, and we're working on our developing plan of corrections. Same thing in December, first week of December, the Fire Life Safety and Emergency Preparedness Survey was conducted from December 4 to December 7. There were at least 3 surveyors on site, and we also received our plan of our statement of deficiencies, and we're working on developing the current plan of corrections. So for the plan of correction that were received in or for the plan of correction that we have submitted for those statement of deficiency that were received in November and December, we have submitted those plan of corrections. For November, we received 2 statement of deficiencies. This is from 2 anonymous complaints and 1 facility reported incident in 2023. And for the December, we received 4 statement of deficiencies, 1 from anonymous complaint in 2023, and the other 3 were from facility reported incidents back in 2020. So our plan of corrections were submitted to CDPH as well. Please let me know if there's any questions or comment that I can address at this time. Thank you.
Hey, thank you. Is there public comment?
Hi, folks. We're on item 5, the Regulatory Affairs Report. Please press *3 if you'd like to make comment. I see 1 hand. Quickly put 3 minutes on here. Hi, Mr. Manette Shaw.
Hi. right, thank you, Mr. Morwick. These two reports indicate 5 FTAG violations during November, December for the Medicare surveys that required plans of correction, including FTAG 550 on resident rates, FTAG 609 on reporting of alleged violations, and F689 free of accident hazards and devices, all of which involve substandard care. Additionally, there was an F657 care plan timing and revision violation, suggesting Laguna Honda staff continue having problems with care plan development and adherence. Laguna Honda was previously cited to decertification for violating all 4 of those FTAGs. Another violation involved F624, preparation of safe and orderly transfer and discharge, which Laguna hadn't violated previously, although there were unsafe discharge and evictions of residents in June 2022 that led to the 12 patient deaths and involved fines. Neither regulatory report indicated the scope and severity of the 5 citations, but should have, and you surely know how severe those 5 citations were. What are you hiding? Were there any more immediate jeopardies? Additionally, plan of corrections were submitted for the 3 California Health and Safety Code 1280 violations over potential patient medical records disclosure. As a reminder, in December 2021, Laguna Honda was assessed a $250,000 administrative penalty for a medical records breach. Are you going to be getting more administrative penalties for more medical records breaches? What's going on with that? Why aren't you telling us about that now? Thank you.
All right, that's the only public comment for this item.
Okay, are there any questions or comments from the members? Dr. Green?
Yeah, I had one just question correction, which is that on the December report, you have a staff to resident says 1 pending outcome, 3 pending outcomes. Did you mean 1 investigation not started? It's the second thing, staff to resident under 22 cases, November : So it's labeled as December. They're both labeled as December 2023, actually, but I believe it's the November report. It's under 11 allegations. It's got staff to resident. It says 4. It says 1 pending outcome, 3 pending outcomes. Is that 4 pending outcomes, or is there 1 that actually is not under investigation? Do you know offhand about that?
So for that one, Commissioner, let me just find, okay. So this is the pending outcome from CDPH investigation. So most likely because they had a lot of review when they had the certification survey. So there's a lot of fines that they look at. So so this was still in November, and I have to check whether this corresponds to that, like their incident report, if they have completed it or still pending. So there's a lot of fries that they look at when they were here in December.
Okay, thank you. And then, it might be really helpful if when you list the plan of corrections, and I don't want to create too much work here, but if you could link some of these plan of corrections to the actual time that the incident that you ran through them, and I was trying to follow you, but because we have plans of correction that relate to the Medicare recertification, then we have things, as you've said, that are from the past. It would be very helpful to understand in each one of these plans what the original, when the original fry was reported, or when the original observation was made, so we can kind of understand better what is really current and you're working on now versus what was in the past. How many of these were from which survey? Did they come from a survey, or did they come from, I mean, we have so many different pending investigations. So if we could understand, it would be very helpful.
Will do, Commissioner.
Thank you. No, I had no other questions. Thank you.
Okay. Dr. Chow.
Yes, I had only one question, which goes back to the number of fries not looked at, and clearly on your charts, you're showing that the 2023 anonymous complaints have all been, reviewed or certainly are pending, but there are plenty of grays that are left from 2022 and 2023, and I know that in the past there had been some discussion of trying to clean those up, and or else trying to validate whether these are really still outstanding. So have we gotten anywhere on clarifying this, or are we so busy, as we should be, of course, on writing plans of correction that this has not been resolved yet?
I can help with that. Good afternoon, commissioners. So I have attempted to reach out to CDPH again to get clarification on where we are in reconciling our cases, and I am still waiting to hear back.
Okay. All right. Well, at least it hasn't held up the certification. So
that's right. I think that's everyone's priority, but we will continue our due diligence to see where we will stand once we are certified.
Okay, thank you. That's all I have.
Okay, we can move on.
Thank you. Item 6 is an action item. It's the Laguna Honda Hospital policies, and this action would be recommending that the full commission approve these at the January 16th meeting.
Okay, Ms. Trin?
I can read the summary, or are we going to wait until then?
Can you speak up a little bit? Thank you.
Do you want me to read the summary, or are we just going to move it over to the full health commission?
I think, she was asking whether she should read out the summary or just go straight to any additional questions that haven't been answered for the members. I think
It's up to you all.
actually, Dr. Chow, you had, I think you had one in particular that you wanted to have addressed.
Yes, if you wanted to go that way, the one that I thought was fairly important was the let me see which one it was, 72-01 C26 on TV, where you spoke to the employees who receive BCG vaccine shall be included in the TST screening program. And my point was that the way that it was reading it sounded like if somebody were just reading that and thinking, here's an employee and we need to do a test, that we do the TST. And I was suggesting that we should take the CDC recommendation that in the case of doing a screen on somebody with BCG, that we should be using the IGRA, and that should be part of the policy.
Thank you, Commissioner Chow. Noted. We have forwarded the comment to the policy owner. I'm waiting for that.
That didn't come out too clearly, so I'm not quite sure exactly. Was that a yes, no, or I don't know?
May I restate it, Carmen, so that it's a little clearer? Dr. Chow, she said that your question and comment have been sent to the policy owner, and that person will respond, and that won't be today. It'll be before the January 16th meeting.
Oh, that would be fine. I just wanted to bring that to the attention because I know that a number of people have received BCG, and the wrong test could create quite a reaction. I just thought we should be clearer in the policy on that. The others were smaller points.
Yes, Commissioner Green.
I also submitted a series of questions. Some of them were grammatical, where sentences weren't clear. Some of them were questions about whether we needed to become more inclusive in things like dictating certain vaccines for staff or getting information like Tdap, for example, which wears off after 7 years. I mean, there were a few aspects that I raised that are more, really not so much. There's nothing that I thought was needed correction, but I think there were some things that might have benefited from amplification, and then just a few grammatical things. And I submitted those. So if if I'm hearing correctly, these are going to the appropriate owners of those sections of policies, and that we'll get some kind of response. So I think we can feel comfortable approving these to submit to the commission, and then between now and the meeting, we'll get those clarifications, and that would be great. I mean, most of what I submitted was more kind of detail or expansion rather than correction of policy.
Okay, and can we be assured that we'll get the answers to those questions and clarifications prior to next Tuesday, or actually even before that?
Right.
Yeah.
Hopefully Monday. Oh, actually Monday's a holiday, Commissioner, so it would probably be on Tuesday morning because Friday would be early for them with the plans of correction.
Right. Okay.
We'll do our best to get it to you as soon as possible. No worries. Carmen's already been working with folks.
Okay. Thank you. And so we've been there before, so we know what to expect, and we have been gratified to get the answers to all of the questions and clarifications, usually in plenty of time prior to the full commission. So we'll be expecting that, and thank you for working on it.
So Commissioners, we skipped a step because we went right from summary to your comments. So I'd like, if it's okay, can we go to public comment? We've got one person.
Yes, please. Sorry.
No problem. Mr. Minetshaw, you've got 3 minutes.
I didn't want to speak on the policies. Is that what you were referring to?
Oh, yes, your hand is up. So, all right, great. I'll mute you and we'll see you at another item, I'm sure, or hear you. Okay, Commissioners, then.
We have a motion to recommend approval to the full commission for the submitted policies per the updates that we'll receive.
So moved.
Second,
And I'll do a roll call vote. Commissioner Chow, how do you vote on this item?
yes.
Commissioner Green, how do you vote on this item?
Yes.
And Commissioner Guillermo?
Yes.
Okay, great. This will be on the consent calendar at for the full commission January 16th meeting. Thank you. We can move on to item 7, a consideration for a closed session.
Okay, is there a motion for a closed session?
So moved.
Second,
And we have a member of the public who'd like to make comment. Oh, he just bounced off. Let's see. Mr. Minetshaw, I saw that you're gone, so we're not able to allow you to have comment. I'm just noting that for the record. I will do a roll call vote. Commissioner Chow, how do you vote on this item?
yes.
Commissioner Green?
Yes.
And Commissioner Guillermo?
Yes.
Great. Members of the public, you will not see or hear us while we're in closed session, but we will be back. Everyone else, please give me 30 seconds to move us over. And Divina, could you close the door, please? All right, we are back.
Move, so.
Yes,
need a motion to-
please consider motion to disclose or not disclose.
Move not to disclose.
Second,
Commissioner Chow, how do you vote on this issue?
yes.
And Commissioner Green?
Yes.
And Commissioner Guillermo?
Yes.
And then finally, a consideration for adjournment.
Move to adjourn.
Second,
And Commissioner Chow, how do you vote on this issue?
yes.
Commissioner Green?
Yes.
And Commissioner Guillermo?
Yes.
Thank you all.
Okay.
Thank you.
Have a-
Guess get back to work.